All India Radio presents Morning News. Good morning. I'm Sunil Verma and with me is Tanvi Khurana. The headlines. Government says 12 states and union territories show early signs of reduction in COVID-19 cases. India administers over 16 crore 24 lakh doses of COVID-19 vaccines in the country. Union Health Ministry says COVID-19 supplies received from the global community effectively allocated to states and union territories by centre. Tamil Nadu announces new restrictions till May the 20th to curb spread of COVID-19. External Affairs Minister Dr. S. Jaishankar virtually participates in G7 Foreign Ministers meeting. First consignment of oxygen concentrators from Israel arrives in New Delhi. Centre reviews preparedness of 5 states of eastern India to address needs and challenges of current phase of the COVID-19 pandemic. Defence Ministry approves a total of 50 Armed Forces Medical Services AFMS hospitals as dedicated and mixed COVID hospitals. Cabinet approves allocation of additional food grains to beneficiaries of National Food Security Act for months of May and June. CCEA gives in-principle approval for strategic disinvestment and transfer of management control of IDBI Bank Limited. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons of age between 18 and 44 has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news. The government has said that 12 states and union territories are showing early sign of reduction in COVID-19 cases. These states and union territories include Maharashtra, Uttar Pradesh, Delhi, Chhattisgarh, Gujarat, Jharkhand and Ladakh. Briefing reporters in New Delhi, Joint Secretary in Ministry of Health and Family Welfare, Love Agrawal said around 2.4% day-on-day growth in COVID cases has been noticed. Mr. Agrawal said 7 states have 50,000 to 1 lakh active cases, while 17 states have less than 50,000 active cases. He said Maharashtra, Karnataka, Andhra Pradesh, Delhi and Haryana have reported more COVID-19 deaths. Principal Scientific Advisor K. Vijay Raghavan said vaccines are effective against current variants. He said new variants will arise all over the world and in India too, but variants that increase transmission will likely plateau. He said this is a critical time and it is important for all of us to work together and ensure India and the world get out of this pandemic. The cumulative share of active COVID cases in the country has declined to comprise nearly 16.87% of the total reported cases. The Health Ministry has informed that currently over 34,87,000 people are reported to be suffering from the viral infection and are either hospitalized or are under home isolation. In the last 24 hours, the nation registered 3,82,315 new COVID cases. With this, the recovery rate witnessed marginal improvement to stand at 82.03%. Over 3,38,000 people have been discharged from hospitals or are reported to have been completely cured in the last 24 hours. So far, over 1 crore 69 lakh people have recovered from the COVID-19 infection in the country. The Health Ministry has informed that 3,780 COVID-related deaths were reported in the last 24 hours, taking the cumulative toll to 2,26,188. With a special focus on the 5-point principle of test, track, treat, isolate and vaccinate, the number of cumulative COVID-19 testing reported by the Indian Council of Medical Research, ICMR, has surpassed the figure of 29 crore 48 lakh.
India has administered over 16 crore 24 lakh doses of COVID-19 vaccine in the country so far. Over 94,79,000 healthcare workers have taken the first dose, while more than 63 lakh healthcare workers have taken the second dose. Over 1 crore 36 lakh frontline workers have taken the first dose, while more than 74 lakh frontline workers have taken the second dose. The Union Health Ministry said more than 18,90,000 beneficiaries were inoculated with COVID-19 vaccine doses till 8 p.m. yesterday. Out of these, more than 8,66,000 beneficiaries were vaccinated for the first dose and more than 10 lakh beneficiaries received the second dose of the vaccine. The ministry said 2,30,305 beneficiaries in the age group of 18 to 44 years received their first dose of COVID vaccine yesterday and cumulatively over 9 lakh across 12 states and union territories. The ministry said the vaccination exercise as a tool to protect the most vulnerable population groups in the country from COVID-19 continues to be regularly reviewed and monitored at the highest level. The Union Health Ministry has said that COVID-19 supplies received from the global community have been effectively allocated to states and union territories by the centre. The ministry said that the Government of India has been receiving international donations of COVID-19 relief medical supplies and equipment since 27th of last month from different countries including the United Kingdom, Ireland, Romania, Russia, UAE, USA, Taiwan, France, Kuwait, Thailand, Germany, Uzbekistan, Belgium and Italy. It added that from the 27th of April to 4th of this month, 1,764 oxygen concentrators, 1,760 oxygen cylinders, 7 oxygen generation plants, 450 ventilators, over 1.35 lakh remdesivir vials and 1.20 lakh favipiravir strips were delivered. The Health Ministry said a streamlined and systematic mechanism for allocation of the support supplies received by India has been put into place by the Centre for effective distribution of the medical and other relief and support material. Besides, a dedicated coordination cell has been created in the ministry to coordinate the receipt and allocation of foreign COVID relief material as grants, aid and donations. The ministry said all these relief medical supplies and equipment are being allocated in a timely manner to the 38 medical institutions across 31 states and union territories so far in the first tranche. This will help to supplement the medical infrastructure of these institutions and strengthen their clinical management capacities for prompt and effective clinical management of the hospitalized COVID-19 patients. The cargo clearance and deliveries are facilitated without delay in coordination with agencies concerned.
Tamil Nadu has registered more than 23,000 fresh cases yesterday. The Health Department said more than 1,25,000 people are under treatment and more than 160 deaths were reported. Due to the prevailing pandemic situation, the government has announced new restrictions and also 9 higher police officials to monitor the logistics and other necessities needed to manage COVID. More from our correspondent.
The new restrictions will come into force from today to the 20th of this month. Transport facilities like rail, metro and bus services will be allowed to operate with 50% passengers only. Private and government offices will have 50% attendance. No other shops except groceries, vegetable and tea shops without air-conditioned facility will be allowed to function with 50% customers till 12 noon. Auditoriums, open-air meetings and cultural events are banned. Only 20 people will be allowed in funerals and 50 persons in marriage. Curfew will continue on Sundays. Essential services like media, freight and medical emergencies are allowed at all times, and night curfew will continue from 10 p.m. to 4 a.m. till the 20th of this month. Joy, AIR News, Chennai.
Gujarat has recorded 12,955 new cases of COVID-19 yesterday. According to the State Health Department, 12,995 patients recovered during the last 24 hours and were discharged from the hospitals. More from our Ahmedabad correspondent.
Maximum 4,174 new cases of COVID-19 reported from Ahmedabad, while Surat recorded 1,168 new cases. 133 patients lost their lives yesterday. With this, death toll due to COVID-19 in the state has reached up to 7,912. Gujarat has now 1,48,124 active cases at present, out of which 792 patients are on ventilator. Meanwhile, 1,32,384 persons were vaccinated in the state yesterday. Sri Somnath Trust has announced rupees 50 lakh donation to the local community health center at Prabhas Patan to set up an oxygen plant. Yogesh Pandya, Air News, Ahmedabad.
In Chhattisgarh, public representatives, social organizations and common people are contributing significantly to deal with the COVID crisis in the state. More from our Raipur correspondent.
In Dhamtari district, 8 ventilators and 300 jumbo medical oxygen cylinders have been provided to the district hospital with the financial support of Member of Parliament and local legislators. At the district headquarters of Baloda Bazar district, a 600-bed COVID care hospital is being constructed with the help from the public representatives, industrial establishments, along with the contribution from District Mineral Fund. Besides, a 100-bed COVID hospital has been built in the capital Raipur with the help of Jain community. In Rajnandgaon district, sculptors and painters are jointly sanitizing homes in rural areas. Vikalp Shukla, EIR News, Raipur.
In Odisha, the COVID-19 vaccination coverage has been extended to about 59,51,000 people so far. However, due to non-availability of adequate vaccines, the state could vaccinate only about 22,000 beneficiaries at 92 session sites yesterday. A report from our Bhubaneswar correspondent.
Even as the viral upsurge continues to add fresh infections to the state's active COVID tally, pushing it further beyond 77,000, the state from yesterday is observing a 14-day lockdown to stamp the surge down. The virus currently is infecting about 8 to 10,000 people daily. The state chief secretary asked senior officials to target arresting the growth rate of the virus in about a week's time through heightened awareness among and strict surveillance on the people. To this effect, the government has already put the desired curves on the movement of the people while disaggregating markets all across to ensure decrowding during the purchase of essential items. Girish Chandra Das, EIR News, Bhubaneswar.
In Maharashtra, new and active corona patients are declining. Now the state has started preparation for the third wave of coronavirus. More from our Mumbai correspondent.
In order to increase oxygen availability, the government has announced Mission Oxygen. Maharashtra's daily demand for oxygen is 1,700 metric tons, out of which 1,200 metric tons is produced in the state and remaining is imported from other states. Now, the state has targeted to produce 3,000 metric tons of oxygen on a daily basis. Chief Minister Uddhav Thackeray has ordered district administrations to set up oxygen plants in each district. Many children and teens are tested positive in second wave of COVID-19, due to which Brihan-Mumbai Municipal Corporation has decided to set up separate 700-bed pediatric ward as a preparation for third wave. It will have neonatal ICU, pediatric ICU and special beds for infants. Jeevan Bhavsar, AIR News, Mumbai.
Leh district will be under lockdown from tonight till Monday morning. District DDMA Chairman Shrikant Seus issued additional restrictions to contain the fast spread of coronavirus in the district. More from our Leh correspondent.
After alarming rise in number of COVID positive cases, Leh DDMA ordered for additional restrictions in the district. Following the COVID curfew last weekend, an 80-hour lockdown is ordered starting from today 9 in the night to 5 in the Monday morning in Leh district. During the restricted period, all government, judicial offices, essential and emergency services like power, water, banks, commercial services like petrol pumps, cold storages, ATMs, and army and paramilitary movement, COVID vaccination, testing and medical emergencies and public transport for the relaxed categories are allowed. DDMA also arranged helplines and e-pass facilities to address emergencies. Passengers and tourists coming to Leh can produce their ticket or boarding passes for their movement. Ramesh Chandra, All India Radio News, Leh.
Karnataka reported the highest single-day spike in COVID-19 cases and deaths yesterday since the outbreak of the pandemic. It recorded 50,112 new COVID-19 cases and 346 deaths in a single day yesterday, taking the total active cases in the state to 4,87,288. The positivity rate has sharply risen to 32.28%, and the case fatality rate stood at 0.69%. Bangalore Urban District alone reported 23,106 new cases yesterday. The state also saw 26,841 people recover from the infection who were discharged. As on date, 12,36,854 out of 17,41,046 COVID active persons have recovered from coronavirus infection in the state. Niti Aayog member Health, Dr. V.K. Paul, has requested the physicians' fraternity to come forward and provide teleconsultations to people and families at home who are infected with COVID-19. Briefing reporters in New Delhi yesterday, Dr. Paul said the response to the changing virus remains the same. He stressed on the need to follow COVID-appropriate behavior such as mask, distancing, hygiene, no unnecessary meetings, and staying at home.
हमें एक माहौल पैदा करना है कि हम सबको अगर जरूरत पड़ती है तो सामने हो कि मैं यहाँ फोन करूं, चाहे वो एक हेल्पलाइन बन जाए, मल्टीपल हेल्पलाइंस बन जाए, चाहे इंडिविजुअल्स का नाम आए जो अखबार में आ जाए या पता लगे कि यहाँ इस शहर में किसको फोन कर सकते हैं, या स्टेट लेवल पे ऐसा सिस्टम बने, इसकी बहुत जरूरत है। लगभग सब स्टेट्स ने अपने तरीके से ऐसी हेल्पलाइंस बनाई हुई है, लेकिन उसको कॉम्प्लीमेंट करने की जरूरत है। तो एक रिक्वेस्ट है कि ऐसे जो फिजिशियन कम्युनिटी है, प्रोफेशनल्स की टीम्स हैं, इसमें जुड़ें तो बहुत मदद होगी।
The principal scientific advisor, K. Vijay Raghavan, has said that after the second wave of coronavirus infections, the third wave of the pandemic is inevitable, for which we have to be prepared. He said it is not clear at what time and at what scale this phase 3 will occur.
A phase 3 is inevitable, given the high levels of circulating virus, but it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape, and therefore we should be prepared scientifically to take care of that.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Government says 12 states and union territories show early signs of reduction in COVID-19 cases. India administers over 16 crore 24 lakh doses of COVID-19 vaccines in the country. Union Health Ministry says COVID-19 supplies received from the global community effectively allocated to states and union territories by centre. Tamil Nadu announces new restrictions till May 20th to curb spread of COVID-19. External Affairs Minister Dr. S. Jaishankar virtually participates in G7 Foreign Ministers meeting. First consignment of oxygen concentrators from Israel arrives in New Delhi. Centre reviews preparedness of 5 states of eastern India to address needs and challenges of current phase of the COVID-19 pandemic. Defence Ministry approves a total of 50 Armed Forces Medical Services, AFMS hospitals as dedicated and mixed COVID hospitals. Cabinet approves allocation of additional food cranes to beneficiaries of National Food Security Act for months of May and June. CCEA gives in-principle approval for strategic disinvestment and transfer of management control of IDBI Bank Limited. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts. चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे. External Affairs Minister Dr. S. Jaishankar participated in the G7 Foreign Ministers meeting through video conference yesterday. After the meeting, Dr. Jaishankar said it was an interactive and thought-provoking meeting. He appreciated the opportunity to participate in its many conversations. During the meeting, it was discussed that vaccination is the only lasting solution to the COVID-19 challenge. A global answer will require diversified production, uninterrupted supply chains, and generous resourcing. Dr. Jaishankar said
India will do its part. He noted that geopolitical changes have been accelerated by COVID-related trends, and issues of transparency, reliability and resilience will guide policy choices. Dr. Jaishankar said India had embraced green growth since 2014, and transformation stories include renewable capacity, Ujjwala, LED distribution, forest cover and Jal Jeevan. He said, but higher green ambitions require larger green resources, and COP26 will be a test.
The first consignment of oxygen concentrators from Israel has arrived in New Delhi. In his message, Israeli Ambassador Ron Malka has said that more such flights will follow throughout this week, carrying emergency medical aid, including thousands of group and individual oxygen generators, respirators, medications, and additional medical equipment. He said, our friendship is strong and collaboration during the COVID-19 crisis will only make it stronger. A task force was set up to gather support for Israel's aid to India. Several private entities, Israeli companies, NGOs and the people of Israel came together to contribute towards this aid. Centre reviewed preparedness of 5 states of eastern India to address needs and challenges of current phase of the COVID-19 pandemic. Union Health Secretary Rajesh Bhushan, along with member Health Niti Aayog Dr. Vinod K. Paul, chaired a high-level meeting with the states of Assam, West Bengal, Odisha, Bihar and Jharkhand. The review meeting assessed the arrangements put in place by these states for containment and management of the COVID-19. The evidence suggested that the pandemic is moving eastward and a rise has been observed in the number of daily cases in these states along with rising mortality. During the meeting, 5 critical areas of action were discussed for addressing the needs and challenges of recent phase of the pandemic in the states.
Indian Army has clarified that the Defence Ministry has approved a total of 50 Armed Forces Medical Services AFMS hospitals, including 42 Army, 5 Air Force and 3 Navy designated as dedicated and mixed COVID hospitals. Besides the entitled clientele of the AFMS, serving personnel, dependents, veterans and their dependents, civilians may also be admitted subject to referral by the local health authority after ascertaining bed availability at these facilities. Indian Army said it has come to its notice that there is a full list of AFMS hospitals being circulated in social media claiming that they all are open for admitting COVID-positive civilian patients. The Defence Research and Development Organization DRDO has stepped up its efforts for manufacturing of several medical equipments like ventilators, micro-oxygen cylinders and oxygen concentrators to provide relief to the COVID patients. In an exclusive interview to AIR News, DRDO Chairman Dr. G. Satish Reddy said DRDO is continuously engaged in the production of 150,000 mini oxygen cylinders for household needs. He said these micro cylinders would be available by the next week at an affordable cost. In the Union Territory of Jammu and Kashmir, a new 1,000 litres per minute LPM oxygen concentrator plant was commissioned at Government Medical College, Rajouri, yesterday. AIR Jammu correspondent reports that the oxygen concentrator plant will help in augmenting bed capacity in the border district for successful treatment of COVID-19 patients. With the commissioning of the plant, the district has become self-sufficient in terms of medical oxygen needs. Deputy Commissioner Rajouri, Rajesh Shavan, said that the plant is a lifeline project in the present COVID-19 scenario. He appreciated the efforts of the concerned executing agency for its speedy commissioning. He directed for ensuring uninterrupted power supply to the plant for hassle-free oxygen supply to GMC, Rajouri and its associated hospitals.
The Cabinet, chaired by Prime Minister Narendra Modi, has gave its approval for allocation of additional food grains to all the beneficiaries of National Food Security Act for 2 additional months of May and June this year. The announcement towards allocation of additional food grains under the 3rd phase of Pradhan Mantri Garib Kalyan Anna Yojana for another period of 2 months was made by the centre last month. The Cabinet gave its ex post facto approval to this decision, under which 5 kilograms of rice or wheat per person per month will be given to about 80 crore beneficiaries in the country. The Cabinet Committee on Economic Affairs (CCEA) has given in-principle approval for strategic disinvestment along with transfer of management control in IDBI Bank Limited. LIC is currently the promoter of IDBI Bank with management control, and Government of India is the co-promoter. The extent of shareholding to be divested by Government of India and LIC shall be decided at the time of structuring of transaction in consultation with RBI. The Government of India and LIC together own more than 94% of equity of IDBI Bank, and Government of India owns 45.48% and LIC 49.24%.
Chemicals and Fertilizers Minister D.V. Sadananda Gowda has said that a total of 34,50,000 vials of remdesivir has been allocated to states and union territories since the 21st of last month. He said the allocation to states is a dynamic process and efforts will be made to further enhance supply in the coming weeks. Mr. Gowda yesterday chaired a meeting to review availability of drugs for COVID treatment and other essential drugs. During the meeting, Mr. Gowda appreciated the efforts of all 7 manufacturers of remdesivir for increasing the production capacity to 1 crore 3 lakh vials per month from 38 lakh vials per month. He said this increased capacity will augment domestic availability of the injection. In Madrid Open tennis, Spain's Rafael Nadal spoiled Carlos Alcaraz's 18th birthday bash as he moved into the third round with a 6-1, 6-2 victory yesterday. Top seed Nadal now awaits the winner of Australian qualifier Alexei Popyrin and 14th seed Yannick Sinner. In the women's section, top seed Ashley Barty underlined her dominance of the tour with a 6-1, 3-6, 6-3 win over number 9 seed Petra Kvitova in 1 hour and 48 minutes to reach her first Madrid Open semi-final. The Australian will face the only player to have beaten her since February, wildcard Paula Badoza, who became the first Spanish woman to reach the last 4 stage in Madrid with a 6-4, 7-5 upset of number 8 seed Belinda Bencic. 6-time world champion and Olympic bronze medalist boxer MC Mary Kom, along with 2 other Olympic-bound pugilists, Simranjit Kaur, 60 kilograms, and Lavlina Borogohain, 69 kilograms, have been named in the elite women's national camp that will start soon. And now let us take a look at the weather forecast for today. The national capital Delhi is expected to have a thunderstorm with rain. The minimum temperature was recorded at 24 degrees Celsius, while the maximum will be around 38 degrees. Mumbai will have a partly cloudy sky. The minimum temperature was 26 degrees Celsius and the maximum will be around 34 degrees. Chennai will also have a partly cloudy sky with a minimum of 27, maximum 36 degrees. In Kolkata, there will be a thunder shower with strong gusty winds. The minimum temperature was 24 degrees Celsius, while the maximum will be around 34 degrees.
And now, an overview of today's newspapers. The Supreme Court setting aside law on Maratha reservation is the top headline in many dailies. Maratha quota unconstitutional, violates right to equality, says Supreme Court. Headlines The Hindu. The Indian Express quotes the scientific advisor to the Prime Minister as saying, third COVID wave inevitable, didn't foresee current ferocity. Third wave of COVID is inevitable, but can't say when, is the headline in the Asian Age. Small borrowers get RBI's COVID vaccine, writes Business Standard. RBI opens 50,000 rupees crore liquidity tap for banks to on-lend to healthcare sector. Headlines, Hindu Business Line.
And now, before we end the bulletin, the headlines once again. Government says 12 states and union territories show early signs of reduction in COVID-19 cases. India administers over 16 crore 24 lakh doses of COVID-19 vaccines in the country. Union Health Ministry says COVID-19 supplies received from the global community effectively allocated to states and union territories by centre. Tamil Nadu announces new restrictions till May the 20th to curb spread of COVID-19. External Affairs Minister Dr. S. Jaishankar virtually participates in G7 Foreign Ministers meeting. First consignment of oxygen concentrators from Israel arrived in New Delhi. Centre reviews preparedness of 5 states of eastern India to address needs and challenges of current phase of COVID-19 pandemic. Defence Ministry approves a total of 50 armed forces, medical services, AFMS hospitals as dedicated and mixed COVID hospitals. Cabinet approves allocation of additional food grains to beneficiaries of National Food Security Act for months of May and June. CCEA gives in-principle approval for strategic disinvestment and transfer of management control of IDBI Bank Limited. And with that, we end the morning news. Have a nice day.